I'm Dr. Meena Venkatraman. I'm a consultant pediatrician at Cloud9 Hospital, Varttur Road and Old Airport Road. The brain is made up of billions of nerve cells or neurons which communicate with each other by way of electrical signals. Seizures are when there is excessive electrical impulse or an abnormal electrical impulse in the brain. This is like an abnormal physical movement or appearance of the child. Child can have loss of consciousness. It is very frightening for the parent to watch when the child has a seizure. But even though it looks very scary, there are no long-term consequences even if the child has recurrent seizures. So some of the seizures are like the most common ones in children are what is called as simple febrile seizures. They typically occur when the child has a fever. The age group is from 6 months of age to 5 years. The child with fever can have a sudden onset of seizure like a shaking movement. They may become stiff, lose consciousness, stare blankly, and this might go on for up to 5 minutes. And there is a post-ictal phase after the seizure wherein the child is very drowsy and does not respond to stimuli. This is one type of seizures. The others can be recurrent. We call that epilepsy, wherein one of them is called grand mal epilepsy, wherein the child has what is called as generalized tonic-clonic seizure, which again involves either stiffening of both the arms and legs with loss of consciousness, loss of tone, shaking movements of both arms and legs, again lasting a few minutes. Absence seizures wherein the child might stare blankly and again lose awareness is another type. Sometimes there can be a focal seizure where it involves only one arm or leg or part of the face. So even though it is scary for parents, febrile seizures are typically very benign and we don't start medications for the child. So first aid when the child has seizure is place the baby on one side. Make sure you don't put anything into the baby's mouth because they can choke and aspirate. See if the baby is breathing comfortably. And do not try to stop the shaking movements. And if the seizures last more than 5 minutes, you would need to take your baby to the emergency room immediately. Prevention of seizures, usually if there are any specific triggers like lack of sleep sometimes leads to epilepsy in some children, so that you may have to take care of, and you would need to definitely keep visiting your pediatrician regularly to titrate the doses of medicine if the child has epilepsy. And treatment of seizures depends on the type of seizure, and usually doctors may require an electroencephalogram EEG and an MRI of the brain at times to decide on the course of treatment.